Welcome to Toledo Clinic TV. Dermatologist Dr. David Kouba is with us, and we'd like to spend the next few minutes talking about skin cancer. It's probably more common than many of us realize.
Oh, absolutely. Basal cell carcinoma is the most common cancer to happen in humans, period. So there's over 2 million cases diagnosed in the United States every year.
What are the risk factors for not just that type of skin cancer, but others as well?
Sure. Fair skin is probably the most common risk factor. So, light eyes, blue eyes, fair skin. Really, in having a history of excessive sun exposure over your lifetime, a history of repeated burns, all those things really portend kind of a poor prognosis when it comes to the development of skin cancer.
Should everyone be getting a routine skin cancer screening? Should that be a normal part of our preventative health?
Absolutely, absolutely, especially if you have a family history, because if you have a family history, you're significantly increased risk for having skin cancer yourself. So a first-degree relative, mother, father, sister, brother, having skin cancer really puts you at risk. And using the routine, what we call them full-body skin exams every year or every 6 months, is a good way to catch pre-cancers, so cancers in their infancy. And then removing them is really simple. We also then can focus on prevention. So if we see a patient who has a lot of sun damage, they have a lot of precancers, there's a whole different list of techniques that we can use. Some are controlled by the patient at home, some that we can do in the office, that can really minimize their risk of developing cancer in the future. So we have, for example, tretinoin. Retin A, a vitamin A derivative cream. It's been used for decades for multiple things. For example, we use it for acne in children. Some adults use it for wrinkles. But really, one of its best uses is for the prevention of skin cancer.
And anybody could use that, or is that really
absolutely.
for high risk?
No. It's a prescription, so we give it in our office. We actually have generics in our office too, to make it affordable for patients. And in my view, patients should be using tretinoin or retin A cream really every night, at least when they're 30 years old. So that would, if everyone did that, we would have far fewer skin cancers. In addition, there's some vitamins that patients can use. So some recent data has shown that vitamin B3, if taken twice a day, can reduce skin precancers by up to 35%. So that's really simple. It's something the patient can control and the patient can do at home, inexpensive. And really, these things, the vitamin A cream, the vitamin B3, regular skin cancer screenings, that can really reduce your risk.
Is there an age at which the risk becomes higher too?
Well, again, that depends on kind of your genetics and your family history. So if you have a strong family history of skin cancer, then you're more at risk for getting skin cancer early. If you've had a tremendous amount of sun because you were a boater or a golfer or you were a beach lover in your youth, then that's going to predispose you to having skin cancer earlier. And if you have avoided those things, naturally it'll happen a little bit later.
Okay, good information. Thank you so much.
You're welcome.
And thank you for watching.